Hello, Dr. Markle of Centennial Schultz Clinic. Today we're talking about treatment of facet cysts causing radiculopathy. Now, recently I was asked to give a presentation on this topic at our Interventional Orthobiologics Foundation annual conference just in Scottsdale last week. So I figured I could record it and post on our YouTube channel just for more further education. So disclosures, I had nothing to disclose. So getting into the topic, lumbar facet cysts. Now these are actually relatively rare incidents, being about 2% at most of MRIs are seeing facet cysts. They're commonly between L4 and L5 and typically associated with several different factors such as degenerative spondylosis, just means facet arthritis, spinal instability, also termed anterior retrolithiasis, or history of trauma as well. Now, there's several different types of spinal cysts. I'm considering talking mainly on synovial cysts, which are communicating with the facet joint, versus ganglion cysts, which are more fibrous, gelatinous material. They really are more of a surgical indication there. So symptoms of lumbar facet cysts can compress both the thecal sac and lateral nerve root compression, meaning foraminal stenosis where the nerve root exits the spine, or central stenosis where the nerve root is traveling downward through the spinal canal. Now, symptoms typically more lower limb radicular pain, numbness, tingling, can create weakness, as well as neurogenic claudication, meaning the further and more you walk, the worse these symptoms tend to get. Now, if we look at the pathophysiology of this facet cyst, it's a mucoid degeneration or fibrinoid degeneration of the facet capsule. If we look at the exact mechanism is unknown, but the microenvironment is thought to be the chronic inflammatory state that the arthritis creates, screws up the overproduction of proteins as well as enzymes such as metalloproteases, which cause a lot of cellular proliferation or dysfunctional collagen, and that creates the weakening of the facet capsule. And over time, that more fluid that builds into the facet joint weakens that facet capsule and allows that or not disc, but facet capsule to bulge. And if it bulges backwards or forwards, it's into the spinal canal. So treatment of the lumbar facet cyst, historically, if you go to an interventional pain doctor who does more injection-based therapies, they offer a steroid injection, see if they can just calm down the inflammation, or they use steroids as well as a large volume to see if they can rupture the cyst in itself. If we look at meta-analysis of all the studies that have been done on these two techniques, really they come up with the conclusion that it's more of a coin flip whether or not it's really going to help long-term wise. And those other 50%, if that doesn't help, typically get sent off to the surgicals. A lot of our spinal surgeons, our counterparts, have a good reputation as well as good track record looking at the research for getting these facets to resolve with or without a fusion, depending on your degree of lethesis or instability. The problem with that, while it's a high success rate, getting a surgery on your back long-term wise does accelerate some degeneration of your back. If there is a fusion, that can create some adjacent segment disease, further degenerate above and below that level, which long-term wise could set up some additional surgeries down the road. So it's not ideal. So this is sort of like one of the sweet spots for orthobiologics, where traditional medicine really fails, but surgery is probably an overkill, and the long-term results might not warrant getting the fusion. So enter orthobiologics such as platelet-rich plasma, bone marrow concentrate. Here I'm talking mostly about platelet-rich plasma, and it's all I've used to actually treat these. Now, if we look at platelet-rich plasma compares to facet syndrome or facet joint treatment, looking at radiofrequency ablation, versus corticosteroid injections in the joint. PRP has actually been shown in randomized controlled trial level 1 evidence for superiority over of these mainstay treatments, but it's never really been shown in platelet facet cysts. So this will be a case series of 7 of my patients I've treated over the last 7 or 8 years. Like I said, these are relatively rare, so you don't see a lot of them. But when you do, I've come up with a pretty good treatment protocol to sort of get these things to resolve. Now, all these patients had long-standing history of intermittent low back pain, subacute new onset of neurogenic claudication, that walking intolerance causing radicular symptoms. Most commonly, it was at L4, L5 as expected. I've seen one above and one below that I'll go over here shortly. And then average age is about 64 years old. So this usually, again, chronic degeneration over time can lead to this. So usually these patients present in much more older population. So our treatment approach utilizing PRP is a lot different than most traditional doctors. I start by injecting the facet joint itself. We can drain or aspirate the joint, take all that fluid out of there, inject the platelets into the joint. But then we know the disease process is damage to the actual capsule of the joint. So then I proceeded with the multiple different injection routes to inject circumferentially around the facet joint itself in a 360-degree manner. Everything's guided, so I know exactly where the needle is. In addition to that, we take a functional spinal unit approach, meaning in addition to the facet joint, facet capsule, also treating the microenvironment, the instability, which in terms is the ligaments around your spine, also known as supraspinous, interspinous, iliolumbar ligaments. In addition to those, we're treating epidurals around the disc and around the nerves. So we're encompassing everything from an injection standpoint. This is something your traditional spine doctor may not be familiar with, but as we'll see soon, this is the best approach to really get these things to resolve. So case 1 I started about 7-8 years ago. This was a chiropractor locally that I've worked with and refer patients to back and forth. He called me up one day, told me the story, and we got an MRI, saw facet cysts. He's got the anterior lethesis at L4, L5. So there's the facet cyst itself encroaching on the central nerves. And then we ended up treating him. I used this protocol to treat him, and 3 months later, his symptoms all resolved. And curious, we got an updated picture, and the facet cyst resolved 100%, which was great. He was happy, I was happy, and to date, he has not returned from the facet cyst at 7-8 years ago. So knowing that, after that point, that's the protocol I utilized when treating these facet cysts when they do present in clinic. So here's another one shortly thereafter. We treated it, and then boom, I got full resolution of the facet cyst. And then if we look at the facet joints, we can actually see remodeling of the facet joint and the facet capsule, which is encouraging and really hones in the idea that we're able to address the underlying pathology of these facet cysts, which is that chronic degenerative process. So while it's not a cure for the degeneration, it's a way to reverse some of it so the facet cysts don't reaccumulate. And here's one of the L5S1. She had bilateral symptoms. We can see the facets themselves, both right and left, were severely degenerated. She had a small disc protrusion off to the right hand side, which probably led to more right-sided symptoms. Same story, we treated it, same protocol, got the repeat MRI after resolution of her symptoms, showing again the facet joint remodeling. We're seeing the capsule of the joint remodel. While we're still arthritic, it's much less inflamed, and that chronic inflammation has been changed. And here's yet another one, same story. It's unstable 4-5 segment. We treated it with same protocol, and we're able to get that to resolve as well. And this was a case that I gave him a 50-50 chance, given the fact he's in his late 70s, early 80s. with some chronic degenerative states. We decided to go ahead and do it. He flew all the way out from Arkansas, and then lo and behold, right afterwards, radicular symptoms all resolved. The back pain improved substantially, and he's much more functional. And this was several years ago and has yet to sort of reaccumulate and has worsened at this point. And these last two are more recent, where I've not been able to get after MRIs because it's only been a few months. But I have followed up with them recently in the last week or two, showing excellent resolution of the facet cyst. This was a patient causing left-sided symptoms at our L4, L5, and most of those symptoms at this point have resolved. And this was probably the hardest treatment I've had. It's an 82-year-old with severe stenosis, just basically narrowing around the spinal cord. At first, he was getting some weakness in his legs, so we sent him for an actual decompression for the spinal stenosis. He was improved quite a bit after the surgery, but then symptoms started reaccumulating. So we repeated the MRI to find the joints themselves became extremely arthritic, as well as effusion, so swelling in those facet joint, creating now the central stenosis due to the swelling and not the thickening of the ligament. So based on this, I was like, oh, this may be an avenue where we can repeat the treatment here. So we treated him, and then several months later, he's feeling much better. He's still getting some mild symptoms, so this is one case I may have to do multiple injections to get more complete resolution. So if you're dealing with facet, if you're looking for an option for orthobiologics, the biggest question is, what dose is the doctor using of platelets? So if we look at our algorithm and what I've used in the past, the average blood volume I take from a patient is about 350 cc's. Now, average between 2 to 400. A full blood donation or blood draw typically results in about 450 to 500 cc's of blood. So it's well below just a blood donation. We check hemoglobin, hematocrit, make sure the patient's not anemic, and can sustain taking that much volume from her. But it's critical from a volume standpoint because if we look at most interventional doctors that do PRP, they're likely averaging around 60 cc's of blood. While it may potentially be helpful for like knee arthritis or something along those lines, you really need to increase the dose to get these sustained results over a long time. So if we look at our platelet recovery system, we utilize a flexible lab platform. So at 70% recovery, that's about 4950 billion platelets. Again, if we look at the typical clinic, usually they're injecting somewhere in the 10 to 12 billion platelet range. While we can see some clinical benefit, long-term wise, we're not maximizing that single treatment. So that's further divided up into a low volume, high concentrate injection that I use to treat the facet joint itself, facet capsules, and then more of a dilute injectate, higher volume, which we'll inject in the epidural space, and we make several different cocktails of whole PRP called super concentrated platelets or platelet lysates, which is a ruptured platelet immediate release growth factors that we can put safely into the epidural space, as well as treat all the functional spinal unit. So in closing, while facet cysts causing radiculopathy can be extremely difficult to treat, I've shown in the last 7 patients at least that this is treatable and we're able to get long-term sustained benefit from orthobiologic treatments such as PRP, but you really need to hone in on several different key factors. One, the platelet dose, such as super high concentration of platelets, as well as then where do you put the platelets, such as epidural space, facet joint, facet capsule, ligaments, supraspinous, interspinous, ligament flavum, intertransverse, iliolumbar ligaments, to really maximize your orthobiologics effect. And what I've shown recently is this protocol seems to be quite advantageous. So I appreciate your time and attention. If you have any questions, concerns, or if you yourself have been dealing with the lumbar facet cyst and looking for an orthobiologic option, feel free to reach out to our clinic, um, social media, such as Instagram, Facebook, or directly on our website. We can fill out a patient advocate form and they can connect with you to get a telemedicine evaluation with one of our experts. Thanks so much. Take care.